Do you recommend eating the new vegan Beyond Meat Impossible burgers and other similar burgers that are made from a variety of pea and similar proteins?
No, I don't recommend those for a whole bunch of reasons. One, that's not the diet of people. I mean, people aren't supposed to be eating meat. I told you that. It's disgusting. Most people have figured out, at least those of us who become vegan, that it's nauseating to walk down the meat aisle of a grocery store. It's disgusting. It's not our food. So why would you want to make something that looks like it? I can't figure it out. And even go so far as to put heme in some of these burgers so it looks like a bloody something. Don't get it. These things may be environmentally costly. They certainly aren't as cheap as growing potatoes and rice and corn. They certainly are animal friendly. That's true. But will you ever be able to make enough of these kinds of meats to supplement enough the calories in the population of the world? I doubt it. You have to go back to the traditional diet of people, which is starch. Remember, corn for the folks in Central America, the Aztecs and the Mayans, potatoes for the Incas, rice for the people in the Asia and the breadbasket of the world. Remember, starch is the diet. And that's the way we solve the health and the planetary problems, not by going to fake meats. I would find those very disgusting.
What causes weight gain, and what's worse, fat or sugar?
It's fat. The fat you eat is the fat you wear. There's very little weight gain that occurs when you eat sugar. It's because of the biochemistry of the body. The body's very efficient. To take and store fat, you have to get your carbons in a chain. Sugar comes in the form of a ring structure, which is very stable in chemistry. And so to break it down into this chain, which is the fat, takes a lot of energy, and the body doesn't like to waste energy. Whereas if you eat the chains, in other words, the fat, it just moves. It moves from your fork and spoon into your intestinal tract, into your bloodstream, and it's incorporated in your body fat. It also ends up on your skin and gives you greasy skin and acne. But it's incorporated in the body fat, and it's incorporated so effortlessly that you can tell what people like to eat. If they happen to like margarines and Crisco's, if you biopsy their body fat, you stick a needle in their buttocks, thigh, or abdomen, suck the fat out, take it to the lab and analyze it chemically, you find trans fats. If you feed somebody a lot of olive oil, you biopsy their body fat, you find monounsaturated fats. You feed them fish oil, and guess what? You find in their body fat? Omega-3 fats. Yeah, the fat you eat is the fat you wear. And again, to convert sugar into something that can be absorbed and or something that's transported and stored in the adipose tissue, it's very difficult. The human body is very inefficient at doing it. So what happens to all that extra calories that you eat, you ask? Well, those extra calories are burnt off in the most efficient manner possible, which is through heat. It comes out of your lungs and your skin. That's how the body gets rid of those extra calories. It doesn't store them when it comes from sugar. White sugar we're talking about, not just potato sugar.
How do you help a person with multiple sclerosis?
Multiple sclerosis is an autoimmune disease. And actually, the research paper that I recently published was done with Oregon Health and Science University, the neurology department, to treat multiple sclerosis. And we got some amazing results. We didn't get all the results we were looking for, but we got some amazing results. Multiple sclerosis is only found in Western countries, which, by the way, is pretty much everybody around the world now since 1980. And what it is, an autoimmune disease where the body attacks the neurons, the nerves. The myelin sheaths the nerves. And it does it because it gets confused probably by eating dairy foods, or maybe it gets confused by eating the neurons of foreign animals. But anyway, it gets confused, and as a result, you have, it's a little bit complex, but you can go into the whole discussion in my newsletter. It's not that I don't understand it or could explain it to you. You have to break down another barrier, which is called the blood-brain barrier, to get multiple sclerosis. And the whole story is there. And it's all worked out scientifically in the 1950s and 60s by one of my mentors, Dr. Roy Swank, who was head of neurology at the Oregon Health and Science University for 23 years. He did all that work. But, again, it's useless work. Doesn't make any profit for anybody to know this.
Do you recommend statin drugs?
I use statin drugs in my patients. Remember, I'm a real doctor. I'm licensed to practice medicine in 4 or 5 states. I'm a assistant clinical professor at several medical schools. So yeah, I use standard medical drugs and therapies if they do more good than harm. When it comes to statins, still the jury is a little bit out, even though the statin industry has done a lot to provide convincing evidence. There was a paper published in the British Medical Journal just a couple of months ago, where they showed that taking statins compared to not taking statins by this particular analysis increased the chance of living by maybe a day. Certainly it's not very long that it increases your chances of living by taking statins, and everybody knows that. In fact, it is so poor at improving longevity that statins are not recommended for primary prevention. In other words, if you haven't had a heart attack or stroke or heart surgery, then you shouldn't be taking statins. However, for secondary prevention, if you already had a heart attack or stroke, which is when I prescribe them, for secondary prevention, and people who have a high risk of having a heart attack or stroke again, I pull out all the stops. I give them every advantage I have, and I think that many drugs offer more good than harm to people. But percentage-wise, that's not very many. Absolutely, there are a few, not many.